Today I'm standing here with some of my colleagues. Congressman Cummings is here. I know some delegates that will probably show up. Our comptroller is also here with me. But we have a great announcement this morning, and I want to thank Care First for, continuing to invest in our city. You all know that we have an opioid addiction problem in our city, and we need to address it in a major way. And while we've been focused on this problem, Care First is helping the city to move forward by investing some $2.1 million in 11 community health organizations. This is to focus on how we continue to combat opioid use and disorders in Maryland, Northern Virginia, and DC. This is huge for Baltimore City's organizations and the first in the fight against opioid addiction and abuse. I want to thank Congressman for being here, but I want to introduce now Maria Harris-Tilden, who is the Executive Vice President at Care First, to talk about this awareness campaign and this award.
Thank you so much, Mayor Pugh. I am delighted for the opportunity to share this incredible news to you. I'm Maria Tilden. I'm Executive Vice President at Care First, and delighted to share that Care First is contributing $2.1 million to 11 community health organizations working to increase access to substance and opioid use disorders throughout our region, which is Maryland, DC, and Northern Virginia. As a not-for-profit insurer, our mission is to not only provide quality and affordable access to health care to our members, but to also work to increase access to available health care services to under and uninsured populations. According to the National Institute on Drug Abuse, March 2018 report more than 115 people die every day in the United States after overdosing on opioids. And in Maryland, we have the 4th highest instance of opioid-related deaths in the country. The grants announced today are the result of a process that Care First began last year to identify how we could make a meaningful impact on this incredible problem. In addition to adopting CDC-recommended prescribing limits and developing treatment programs for our over 3.2 million members, we are announcing we announced a funding opportunity for not-for-profit community organizations working to address substance use disorders, including opioid use and addiction. In April of this year, we issued an RFP from qualified 501c3 organizations and public health entities seeking funding for programs addressing substance use disorder. We received dozens of worthy applications from organizations all across the region. We enlisted the expertise of over 20 evaluators, psychiatrists, clinical experts, and academicians specializing in public health, addiction medicine, and substance use disorders, as well as our own experts internal to Care First. After a rigorous evaluation process, we identified the following organizations that are here with us today that we felt could make the most impact in the region on this epidemic. So I'd like you to take a look at the screen as we announce the awardees. Anne Arundel Medical Center for $150,000 for their project to save a life. Joe Deaton is the Senior Nursing Director, and Dr. Michael Ramal is the Medical Director who are here with us today. Arlington County Community Service Board, $250,000 for their expanding capacity and substance use treatment program. The Association for the Public Defender of Maryland, $382,000 for the diversion linkages pilot project that they are pursuing beginning this year. Behavioral Health Leadership Institute, $198,000 for expansion of the substance use treatment program. Deborah Angus is the Executive Director, and she's here with us today. Catholic Charities of Baltimore, $150,000 to expand capacity for integrated treatment. Kevin Keegan, the Director of Child and Family Services, is here with us today. Family and Medical Counseling Service, $200,000 for expanding substance use treatment services program here in the state of Maryland. Harford County Office of Drug control policy, $111,000 for increasing access to substance use disorders services project. Joe Ryan, the program manager and administrator, and Linda Williams from Partner Addiction Connections Resource. Healthcare for the homeless, here around the corner in Baltimore, $100,000 to improve screening, intervention, referral, and treatment services. Their CEO, Kevin Lindemuth, is here with us today. University of Maryland Baltimore Foundation, $212,000 to increase access to substance use disorder services via telemedicine. Doctors Christopher Welsh and Annabelle Belcher, both associate professors of psychiatry at the University of Maryland School of Medicine, are here with us today. Western Maryland Health Services System Foundation, $200,000 to establish a community-based crisis center providing outpatient screening, assessment, intervention, and referral services. And finally, the Turk House, $133,000 to increase outpatient program services. Bernard Foster, the executive director, will speak shortly. These organizations will receive funding over the next 2 years to increase services to as many as 115,000 patients in desperate need, and we look forward to working closely with each of them over the lifetime of the grants. Thank you.
And we will now hear from Congressman Elijah Cummings, who has stood on the forefront as it relates to this particular issue. And I think, Congressman, it's important to note that some of our surrounding jurisdictions will be participating in this, because one of the biggest problems we have is that many of our surrounding jurisdictions have not had the kind of support, nor have they built the support systems. And if you were just, for example, to look at what we're doing at Helping Up Mission, 25% of the people who are there are from Harford County.
Good morning, everyone. Good morning. I'm certainly honored to be here, and I want to thank the mayor for her continuing efforts to address this very significant problem. I've often said that in order for our city to be the very best it can be, our entire city must rise. And the mayor has made it a point to do that. There's one population that is going through a lot of difficulty. Many of them are in so much pain that they don't even know they're in pain. And they're constantly trying to figure out how to get beyond where they are. And so to Care First and to Maria Tilden, I want to thank you for this. As I sat here and I thought about this event, I don't know whether all of us know how significant this is. This means that another brother will have treatment. This means another mom who may have been away from her family for so many days or years can now get treatment. It means that some fellow who always wanted to be there for his daughter's graduation but never thought he would make it will have an opportunity to do just that. But more importantly, to these organizations that are represented by folks behind me, I want to thank you because you are on the front line of dealing with a very difficult problem. And the fact that Care First made these grant awards is very, very significant. What it says basically, and as Maria just said, you've gone through a process, and that people, Care First has come to the conclusion that you will be good stewards of the money that you receive. And that's very significant. The mayor has heard me say it many times. I have a major problem with fly-by-night organizations that are not properly treating people. And then they go in, they get so-called treatment, and then they walk out, and then they're not healed. And then they become discouraged for the rest of their lives in many instances. And so this is so very, very significant that you all have received these awards. But there's one other point I make. I know the mayor feels this way very strongly, that government cannot do it alone. We just can't. And so we have to have private entities helping us. And Care First has shown us a model of what that is all about. And so, again, to our grantees, congratulations, and thank you for continuing the fight that you fight. Thank you.
Next, we'll hear from our comptroller and then our senator-elect.
Good morning. All of us know from the reports of opioid overdoses and the devastation that the substance abuse is having on families and communities, any effort to stem the tide of this problem is met with great encouragement. This substantial effort brought forth today by the mayor and Care First is not only encouraged, but calls for the full unwavering support of all of us in our community. The cost of this crisis is recognized through health care escalation, increased contact with the criminal justice system, and sadly the deaths that result from this scourge. I pledge my support to this endeavor, and I ask the citizens and interests of Baltimore to do so as well. Thank you.
I know that Carolyn is here representing our president of the city council. I don't know whether you want to say anything quickly.
Good morning. On behalf of Council President Jack Young, I just want to express my support for this endeavor. It's always awesome for people to have an opportunity to do better, and I look forward to the impact that all of these funding organizations will have on the opioid and drug crisis. Thank you.
I'm going to hear from our senator-elect, Antonio Hayes, also to recognize that we have representation from Senator Ben Cardin's office. I don't know if there are any other. Oh.
Ms. Carden.
No, I know the name.
Adrian.
Oh. Is Adrian here?
No, I'm representing.
Oh, Delegate Adrian Jones is represented here as well. Now we'll hear from our senator-elect, Antonio Hayes.
Good morning.
Good morning.
Good morning, Madam Mayor and everyone. I'm very happy to be here. Since coming into the legislature 4 years ago, I've made behavioral health one of the number one issues that I fought for. And mainly for me, it's a personal issue. In April of 2018 of this year, I laid my mom to rest, who suffered years of addiction from substance abuse with a dual diagnosis and mental health. And so it's so important to so many in Baltimore City and throughout our state that we put a huge focus on this. And I want to thank Blue Cross and Blue Shield and the partners here, Turk House and others, who are stepping up to the cause and providing this much needed service to so many residents here in our city. You know, we often talk about the number of victims that succumb to gun violence here in our city, but if we look at the lives that have been affected by overdoses, climbing each year close to almost 800 just here in Baltimore City, it's devastating, and it has a lasting effect on trauma, not only on those who are addicted, but also the families that are associated with them. So thank you for this effort, and we look forward to doing more as we go forward to make Baltimore and Maryland a safer place for so many families. Thank you.
And our final speaker is Bernard Foster. Are you here?
Good morning. Thank you, Madam Mayor. Thank you, Congressman Cummings, for this great opportunity. My name is Bernard J.B. Foster, and I'm the Executive Director of the Turk House. First and foremost, I want to register our profound gratitude on behalf of the patients we serve and the organization for this great opportunity. Turk House has been a fixture in the Baltimore City community for the past 50 years, providing addiction treatment to the citizens of Baltimore. Over the last 50 years, we've seen over 40,000 patients, and still counting. We are pleased to be chosen and selected by Care First as a partner in this endeavor. One of the things that this grant is going to do for us is that it's going to expand treatment in our outpatient setting. Secondly, it's going to be able to allow us to add peer recovery specialists to what we do. Peer recovery specialists are sort of the foot soldiers in going from house to house and encouraging our patients to be able to let them know that treatment works. only if we will engage them. And so this allows us to do that. Finally, this grant allows us to debunk the myths surrounding medication-assisted treatment. This will allow us to be able to provide education not only in the organization but also in the community at large, so that everybody's better served by what we are doing. We are once again extremely pleased to Care First for this opportunity, and our hope is that moving forward we'll be able to foster more collaboration together with our city and our state stakeholders in making sure that we treat our patients. Once again, thank you, Madam Mayor. Once again, thank you, Congressman Cummings. Thank you so much.
Any questions for anybody up here? Okay, thank you.
Sorry, actually I do. About a year ago from today, actually, the President Trump announced that, that the opioid epidemic was in a state of emergency or something along the lines of that, saying it was an emergency. In the opinion of Congressman Elijah Cummings or Care First, do you think that he's done enough so far in his administration to combat this epidemic?
I'd be glad to answer that question. No. No, he has not done enough. As a matter of fact, I've issued a number of press releases, even with our most recent bill that I think he signed yesterday. It's not enough. We spend a lot of money on the federal government on various things, and not enough on this situation where you got close to 200 people a day across the country dying. And we can do better. That's why the mayor has been so supportive of Senator Elizabeth Warren and I. We have filed what's called the CARE Act, which would allocate $100 billion over 10 years so that we can have flexibility with regard to distribution of funds to organizations like the ones here, to our state government, and to our local government. It would also address the whole issue of training doctors so that when they come in contact with people who may be drug addicted, they don't treat them as if there's a stigma attached to them, and they know how to treat them. And then the other thing that it goes to getting more naloxone on the streets, and it deals with making sure that the treatment that people get is effective and efficient. All right. So we're hopefully when the Congress is taken over by the Democrats, we'll be able to.
So I don't know if you know that Elizabeth Warren and Congressman Cummings hosted an event here around this CARE Act.
Yeah.
And I love the word flexibility, because one of the things we talked about were transportation needs and also housing needs.
Yeah.
It's difficult to treat people if they don't have a place to stay. And so the flexibility of the CARE Act, I think, will help us to accommodate that as well. So really we'll be working to help push that legislation.
Thank you.
Take care. You want to say anything?
Look, we believe that a crisis of this magnitude requires a multifaceted approach to address every piece of the problem, and the federal government is doing what they're doing, and they need to do more. But we saw an opportunity to contribute and support a critical need in the community, and it's our responsibility as a not-for-profit insurer that has a not-for-profit mission, and we want to take every opportunity to fill that void and make a difference, and we'll continue to do so with this problem and others that the city and the region face.
Okay, whenever there's a crowd like this, y'all have to excuse me. We're in a voting process. And we are now number 11 city. We're 11. We got to get in the top 10. So every chance I get when there's a crowd in the room, just to remind you all, you can vote 5 times a day for the Arts Social Club. They will have an opportunity to participate in a $2 million grant. I'm going to keep announcing that throughout the press conference. So please, your organizations individually, you get to vote 5 times a day, 5 times a day. Tell your children before they leave home, vote, 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 vote. The husband, when he comes in, the boyfriend, the girlfriend, everyone, vote. Your neighbors, knock on doors. This is a campaign. We've got to win. Okay. Thank you all. Take that back to your offices. Thank you, everyone. This is very important. So I think it was back in June of this year, I announced that new resources would come online in FY19 to support neighborhood-based partners organizations. Targeted funds to stand up and strengthen our neighborhood-based organizations is critical to our collective success. The Community Catalyst grants launch with a $5 million investment from the Department of Housing and Community Development. This is a program that provides capital funds totaling about $3 million and operating funds totaling about $2 million for community-driven revitalization. The CCG grants are central components to my effort to bring investment into neighborhoods and that will help us to really do some of the things that have been not invested in for decades. And since we announced these funds, we've been working with community groups and stakeholders to establish guidelines and application requirements. Those guidelines for operating grants have been finalized, and today we're announcing the release of the applications for funding. I'm joined here by Michael Braverman, who is overseeing those grants, and this is the first for our city, making $2 million available in annual operating support for capacity building. We expect the grants will be 100,000 or more, maximum grants 100,000 to help these organizations. So having said that, I'd like to hear from Commissioner Braverman, and if he wants to answer any questions, he can do so as well. Come on up, Commissioner.
Thank you, Madam Mayor.
You see how he slid into the picture.
Yeah, thank you. I think this is a really exciting moment as well. We just talked about $2 million, a little bit $2 million plus that Care First is putting out on the street for this critical issue in Baltimore City. This is $2 million, Mayor, that we're putting on the street here in Baltimore City to benefit our community partners. So the community development work that you're committed to, the new era in neighborhood investment, really starts with our community partners, and the hardest dollars that for them to come by are operating dollars, the types of money that it takes to build capacity in their organizations. And your administration has dedicated $2 million annually to meeting that need, to build the capacity of our partners that really do the work that define what our community development agenda is. And I wanted to say that your request that this money go out on the street after an extensive process of working with the community leaders to identify how to best serve them with these grants so that they meet their needs and are not onerous in how they get out on the street. These are not CDBG dollars. These are local, non-federal dollars that we can get out on the street in the most flexible manner to support our community partners. So the CCG operating grants are on the web today.
The applications are due by November the 30th.
By November the 30th.
Awards are expected to be made in January. And, you know, we walk neighborhoods and communities, and I'm sure neighborhoods like Oliver will be applying. Our hope is that that others across the city will apply, because we want to strengthen those organizations, because they're going to become an integral part in how we redevelop neighborhoods and communities. And so I'm excited, and I'm just looking forward to presenting those grants, and more importantly, to our organizations getting to work. Any questions for Michael? I guess that was...
So these are intended for specifically, like Oliver as an example, but other community organizations that are involved in planning, soliciting investment, et cetera.
Right, they're very flexible. So we're looking for our community partners across the city, on the east side, on the west side, on the northwest, but it can support a wide range of activities. Consultants, planning activities, building capacity within their staff. I mean, there are a wide range of things that they can use those dollars for, and they can spend them over time. So if somebody wants to apply for a maximum grant of $100,000, but they need several years to spend that over that period, we'll be flexible that way too. And we're also placing those dollars, the bulk of those dollars, to support long disinvested communities on Upton, Druid Heights, Penn North, on Johnson Square, Broadway East, Oliver, as the mayor mentioned, Park Heights, of course, Chum, East Baltimore Midway. And those dollars we don't expect our community partners to compete for those same dollars with long-standing, more mature organizations. So we'll have dedicated a certain amount of that just for our, to assure that we meet the needs of our long disinvested communities.
Yeah, so the goal is to raise them up, because many of them, you walk in neighborhoods and communities, as I've walked throughout this city and over 30 some odd neighborhoods, and what we're finding is, associations, will talk about what their needs are, but they're not they haven't formed an organization. They haven't gotten to the point where they can create a CDC. Now, some of them do have CDCs, but they don't have any backbone to stand up. And so that's what this is really focused on. Not our traditional big organizations who know how to go after grants and so forth. This is to help them to be able to get to that capacity that they're helping to control their neighborhoods and what's in it.
What sort of assistance will these community associations who don't have CDCs, who maybe don't have the people in their communities to help them with this sort of grant opportunity, will you be assisting with grant making, have grant makers who are specialized in this to help them out?
There's a couple of ways to answer that. One is some of this money is going to be dedicated just for technical assistance. So there will be a component of this that will only be to provide technical assistance to organizations. But we're also encouraging organizations, if you're not a 501c3 and you don't have the ability to become a 501c3 to apply for these grants, you can partner with another organization as your fiscal sponsor. So we'll both be building capacity directly through grant making, but also through providing funds for technical capacity partners who will work with our community organizations.
Is there any plans to help the organizations partner up with partners? Because if they don't have the capacity to form a 501c3, what gives you the idea that they could?
Right. Another component of the capacity building is the peer-to-peer networking that we think is really critical to meet the need that you just identified. So that's also a component. And it's not that we're that smart, Mayor. It's just that we listen and we meet with our community organizations and we ask what the problems are, and if the mayor wants to invest in communities, what's the best way for her to meet the need to identify the need that we're trying to meet, and that's by talking with our partners.
And it's on Baltimore Housing's website?
Yeah,
Now?
yeah. If you go right now, you go to Baltimore Housing, they'll direct you. Baltimore Housing doesn't exist anymore, but it'll take us a little while, Mayor, to stand on our own with our own website. So go to Baltimore Housing and then look for DHCD, and you'll find the grants.
Okay.
And these are the operating grants, and we will be putting out the mayor is also dedicating $3 million in
$3 million in capital
annually. Those we'll post to the web, and we'll come back before you and talk about that probably in late November.
What's the status of the Perkins Homes TIF?
The TIF itself,
Yeah,
the
like,
legislation hasn't been introduced at this point.
Okay. Do you know when it's going to be introduced?
In the near future, because that TIF will pay for the school.
Before the end of the year, or?
I couldn't commit to a timeline right now with
We don't
you.
have a timeline on that, but what we're looking at, because most of the TIF will be dedicated towards the school itself, which continues to escalate in cost.
Oh, really?
Yeah,
So it's gonna be
I think
bigger
we're,
than 100?
No.
The TIF, the net on the TIF right now is, for the legislation that we intend to propose, the net would be 75 million.
Oh, it's 75 million?
Yeah,
Right.
the total amount's about 100, but you net only after
Right.
all the costs associated with it and putting aside the principal and interest stuff you have to pay. You net 75 million. Mayor's mentioned that right now the school costs are looking to be a considerable part of that. This TIF is about the school fundamentally. So till we fully understand that aspect of the budget, we'll wait till we do that, and then we'll propose the legislation.
okay.
Thank you,
Any
Mayor.
more questions, Michael? Oh, okay, so
Thank you.
I'm going to ask Mr. Raymond and the city solicitor to come forward. They're going to talk a little bit about this overtime audit that is going to be released, but before they speak, I just want to remind us of certain things. Is there overtime abuse? I believe so. Do we have the number of officers in the police department that we should? Absolutely not. If you go back to, for example, 2012, we had 3,017 officers. 2013, 2892, and 2014, 2852, 2015, 2752. And then I think it was around 2015, I believe it is, we went to the shift change, and the numbers continued to go down Today, we're probably at about 2,400 with about 300 and some odd folks on light duty or sick leave. So in essence, we're working with about 2,100 officers currently, and with a shift that where you work 4 days on, 3 days off, 10-hour shifts. People are currently being drafted. That is a part of the overtime because we don't have a number of officers, the numbers that we need. You do know that we did deploy some additional officers to the streets, I think some 200 and something in the last week or so. But at the same time, we're going to the legislature for some additional funding to support additional training and to be able to fill the vacancies that still exist in the police department. As you well know, we're slotted for something like 2,817 officers in the police department. We certainly don't have those, but you can see the decline in the number of officers that we had in 2012 in comparison to what we have today when crime was not as extensive as it currently is. I should also say that while we're still trending downward, we're hanging on by the skin of our teeth. Too many illegal guns on the streets currently, too many drug wars going on in our city, at least on the west side of Baltimore, probably about 7 different drugs being sold and panhandled to our community. And so I know that the focus is on reducing violence, but we must get a handle on our overtime. And so the audit is to be released today, and we want to share that with you. Oh, before I step aside. We are, how many days? 2 days away from the finalization of this vote. And so we're asking everyone in Baltimore to vote 5 times a day. We're in 11th place. We can do this, Baltimore, together. Thank you.
Good morning. As you are aware, the mayor directed an independent external review of Baltimore Police Department overtime. I'm providing a briefing this morning regarding the initial results of the audit and providing this information so that the public is aware of the recommendations that are being put forth and that are being implemented. This briefing has been prepared by the Finance Department, and there's nothing in my remarks that is inconsistent with the auditor's initial findings. Now, we have prepared a written report. It is on the city's website under the City Finance Department under Publications. Now, my remarks will be in 3 areas. I'll provide a general overview of overtime, the findings, and some discussion about the 3 major issues related to the findings. And then I will share with you a set of recommendations, both short-term related to attendance, short-term related to overtime, and long-term recommendations. So my remarks are focused on internal controls in place at BPD as it relates to documentation and monitoring of regular hours reported and internal controls related to overtime. Between fiscal 13 and fiscal 17, overtime doubled at BPD from 23 million to 47 million, just to give you some context of the increase. Now, in terms of the findings, BPD lacks internal controls that would allow the department to ensure that officers are working all of the regular hours for which they are paid, as well as to ensure that any overtime hours are necessary. The failure to maintain appropriate controls over overtime begins with the lack of appropriate policies to govern overtime, and the failure extends through the lack of enforcement efforts. To date, the BPD internal controls are insufficient to document and administer regular attendance. And two, the internal controls are insufficient to ensure that overtime expenditures are necessary, appropriate, and it's undetermined whether the present internal controls can prevent waste, fraud, and abuse of overtime. Now, there's three primary reasons why BPD's internal controls are inadequate. And they are lack of command accountability and enforcement, barriers to effective monitoring and supervision, and third, reliance on manual systems and the lack of technology. I'll go into a little bit more detail in each one. Lack of command accountability and enforcement. As I've stated earlier, BPD's attendance policies and practices do not ensure that BPD officers actually work the regular hours for which they're paid. There's a lack of reasonable controls over ordinary time and attendance, and this extends to the BPD management of overtime. The overtime policy requirements have been regularly ignored in practice. Reason number two, barriers to effective monitoring and supervision. Various investigative units historically have worked out of district police stations or other off-site locations, while the supervisors are located at headquarters. So it's difficult to supervise subordinate staff when they are at disparate locations elsewhere. Accountability is particularly challenging within investigative units such as homicide, where the officers are assigned unmarked vehicles. Even when non-patrol officers report to a defined location, commanders often have limited visibility to where staff are. When I say staff, other officers are, because of their duties. A lot of officers work irregular hours, i.e. Homicide. So it makes it difficult for proper supervision. And finally, reason three, the paper-intensive manual systems and the lack of technology. For the most part, time is kept manually. It's very labor-intensive, lots of paper, lots of forms. The more paper, the more forms you have, the more prone it is to error. Leave slips, overtime slips are voluminous, and it makes for an inefficient process for managing and tracking regular attendance as well as overtime. This hinders the ability of the commanders to control overtime. It's not real time, which means that they're not getting the data that they need in a timely manner to determine who's working overtime, where is it being worked, is it necessary, is it appropriate, and is it reasonable? Now I'm moving to a set of recommendations. The recommendations are, as I indicated, are both short-term and long-term. We want to put these solutions in place so that, one, attendance can be properly monitored, documented, and managed, and two, with the procedures in place, it will help improve the use of overtime so that overtime is only used where it is absolutely necessary under the right conditions when it's warranted, and that it can be properly documented, tracked, and evaluated. So As it relates to attendance for short-term recommendation, BPD has to improve its time and attendance policies. One of the things we're recommending is that all officers be required to report for roll call every morning so that BPD can determine that all staff have shown up on time. Secondly, we're recommending that officers that call in sick at the last minute be required to use sick leave, not another form of leave. And third, BPD needs to implement a policy that prohibits the awarding of paid days off without the use of accrued leave.
Would that be like G-days, Sundays?
Yes, that's a perfect example.
What kind of days are they using besides sick days? Like, when you say they have to use sick days, what are?
Well, in accordance with the MOU, if officers don't use sick leave, they're entitled to 8 days of sick leave, 8 medical incentive days. So if you don't use sick leave, you get 8 days of medical incentive pay. So if you call out sick at the last minute and you're able to use something other than sick leave, you'll get these extra 8 days. It'll be a cost savings if you're not allowed to do that. So I'm moving to the short-term recommendations related to overtime. The department will issue a new overtime policy that defines the expectations for supervisors and officers. We will have enhanced documentation requirements, including, for example, timestamps, and the implementation of disciplinary action for supervisors who are non-compliant with the overtime policies. We're also requiring or recommending that in-service training modules for supervisors on how to properly manage and implement overtime be implemented, requiring individual commanders to monitor overtime through regular reporting and measurements daily, weekly, and bi-weekly for each unit within BPD, and to develop an internal audit function to perform standardized periodic risk-based audits of overtime. Moving to the long-term solutions. The long-term solution deals with technology. As I've indicated earlier, all of the present practices are largely manual, labor-intensive, don't provide real-time data to the commanders. What's needed is extensive use of technology to become more efficient, more effective, to know where the officers are, how many do you have at work every day, who's working overtime, what are they working overtime, where is the overtime assigned, etc. So we believe that with the use of technology that this should ensure and improve regular attendance and improve the use of overtime, limit it to where it's needed, eliminate it where it's not warranted. Long-term technology solutions include biometric time clocks at all BPD locations where officers are assigned, and to require biometric scanning of arrival and departure times for all officers at their assigned locations, to implement and mandate the use of GPS systems that allow limited use of electronic time in and time out using mobile biometric identification software, requiring GPS tracking on all BPD unmarked take-home vehicles, and implementing software for scheduling and time and attendance tracking that can assist the department in forecasting, recording, and allocating overtime. In conclusion, the efforts of BPD to develop and implement a framework that increases internal controls, promotes accountability, and ensures fiscal integrity is a phased process that requires both short-term actions and sustained long-range planning. And the Baltimore Police Department is presently in the process of implementing the short-range recommendations that I have just outlined. And we believe that it is a phased approach. We're moving from certain short-term recommendations and then the long-term recommendations, which will be a later phase, is the technology, which will have a significant price tag.
If I may, Madam Mayor, just to tag on to Mr. Raymond's excellent comprehensive summary, let me just say that, as all of you are aware, we remain in litigation with members of the Baltimore City Police Department and the Fraternal Order of Police, and this audit process has been a part of our litigation. And so on a number of occasions, I've had to say to the mayor, and I've had to say to you all, that these matters are protected by attorney-client privilege and work product privilege in connection with the litigation. The mayor, frankly, has been impatient because she has an interest in transparency, and she's wanted to get whatever we could get out to the public and to elected officials so that they understand that we are moving forward. So what Mr. Henry has summarized is phase one of the audit process, and we've worked with the finance department to make sure that we could put out to you and to the public as much as we could without having an adverse impact on our litigation position. Phase two is underway now, and will dig more deeply into the actual records of actual officers that we will use in connection with the litigation. But we are hopeful that this transparent, the showing of transparency will help people understand that the mayor, as she's about to say, I'm sure, takes the need to address the overtime crisis in the police department is serious, and the recommendations are either being implemented and the policy changes are being drafted as we speak. I've conferred with Acting Commissioner Tuggle, and we are very serious about moving forward with this. We don't believe that there's anything here that conflicts with the existing memorandum of understanding with the FOP, but to the extent that there might be some conflict, and they'll let us know if they believe there are, we will continue to work with them to make whatever changes are necessary.
When the report basically says that people aren't showing up for work and no one's keeping track of it, how on earth could that be in conflict with the FOP?
Okay, I don't know. Let me just say there's something else that I want to address here, and that is the long-term solutions. Judge Badar has told us already we've got to move forward with the technology. And one of the ways to look at that is to look at where we are actually in terms of officers. You know, on our books for our budget, for example, we have 2,800 officers. Every 100 officers represents $10 million. And so we, because of our attrition rate, we're not going to get to $2,800, not this 2,800 officers, not this year, not next year, or the following year, unless we double our recruiting process, and which is something we're working on. And the other issue is, since we don't have those numbers, take that money and use it to invest in the technology. That is the instructions that I'm providing for our finance department, because we've got to get here. We cannot continue to accept, recommendations without implementation. And so I can tell you that we will put that in our budget as we move forward for next year, because we have got to get the technology in place. I've got a few more minutes. I'll take a few questions, and I've got.
It sounds like the command staff is just out to lunch. Who are you going to hold accountable for this?
The next police commissioner and the command staff.
Who would be who?
Not them.
Can I ask you a question to Mr. Raymond? Can you clarify something for me? You said enhanced documents and timestamps. Are you saying there's no time stamping in? I have to, when I come into work, I got to put that I came in at this time, at this date. There was nothing like that before?
No, what I am indicating is that we want timestamps in all locations so that there's a standardization across the department to govern the improved internal controls. Presently, some units may have timestamps, some don't. Some have, as I have indicated, a very manual process for in and out.
So you're talking about out of unit, so units like the homicide unit going into a neighborhood to investigate something in a specific
Across
building, they would
across
have
the
that.
board in BPD, yes.
Okay.
Do you, of the 47 million in FY '18, I think that was the number. I mean, do you have an estimate of what percentage of it may be undocumented, unnecessary, questionable? 10, 20, 30? Any idea? Can you put a number on it?
At this point, no. That will be part of the phase 2, which is the data
drill down.
analytics.
The drill down,
Is that going to be released with phase 2 part to the public?
just as this has been, it will be.
Depending on the litigation and the needs of the
I don't know if any of you can answer this. Back in the spring, I mean, I for one have done, countless police overtime stories. And I did one in the spring, and the then administration in the police department spokesperson said, oh, we're going to implement fingerprint biometrics. Has that happened?
They don't have the technology to do that.
So they told, not just me, they told other reporters in the spring of 2018, they were moving on a pilot program to biometrics.
But have they, I don't know if there's, I don't know of a pilot program that exists currently. I'll check into that, but I'm not aware of a pilot program currently. Okay, thank you.
Thank you.